So now in this case, the AI has missed the sepsis. Now who's responsible? The doctor or the algorithm?
There is one component always required called human in the loop.
Do you as a patient trust AI?
Patients are varied. Their knowledge, their ability to understand, interpret is going to be different.
Is withdrawing life support letting someone die or causing death?
It all depends also on the advanced directives given,
What is the advanced directive?
where the patient makes a living will.
Who should be deciding the end of life? Is it the spouse, the parent, or the court? AI in healthcare. So the focus issue is when algorithm misses sepsis, who's responsible? So there is a scenario where a large hospital is using, a system sepsis prediction algorithm, which is integrated into its electronic health records. So the system continuously monitors patient data, generates alerts for early sepsis risk. But a patient deteriorates rapidly and develops a septic shock. The AI has failed to flag the case in time. The clinician, as all of us are growing digitally, had relied on the dashboard, which was, working fine till now. No alerts appeared and treatment was delayed, and the consequence was taken up by the patient. So now in this case, the AI has missed the sepsis. Now who's responsible? The doctor or the algorithm?
Sorry, the doctor or the
Algorithm. Or
Well, this is also another in the new era of artificial intelligence. We are beginning to see this type of conundrum happening where who takes it? There's also not only responsibility, there's also the not legal alone, but there's a financial compensation laws and so forth that come in. But again, here we have to keep in mind that there is one component always required called human in the loop. So every AI has to have ultimately a human in the loop, and that part of it brings into to play the who takes responsibility is the algorithm it should have had. And so there is a human in the loop even at the building of the algorithm. Again, in the interpreting, again there's a human in the loop. So that will be the important component of who takes the.
so here, sir, should the patients be told that AI is involved in their care? Do hospitals tell, or they're supposed to tell?
As I can see,
Should there be a board in the hospital, like you have consultants? This is the fees. There should be a board that these aspects are, being monitored by AI.
Yeah, what we do now, I come in Australia, they're using it. I went recently to a dermatologist. I had to sign a consent that AI will be, they're using the artificial intelligence even for my, what do you call it, for the discussion or the assessment and so forth. So, they used AI even at that level.
So as of today,
And I had to sign that I agree to it, that I'm happy. So I was given that. You can say no, you don't want it. But,
so if I were to ask you, as of today, do you as a patient trust AI?
again, here you've got to remember, patients are varied. Their knowledge, their ability to understand, interpret is going to be different. So I think you have to be able to. Two things need to happen. That the patient has to give you consent. In order to give consent, the patient needs to have information. And so what I see happening is they give you a little information on what part of AI is going to be used for your assessment and for your treatment. Now, ultimately, that is also given to you with the human in the loop, because as you know, the AI is used to generate, to pick, and ultimately the decision is given by.
So legally, who's responsible as of date? Suppose now here the it failed, so the patient went into a septic shock.
Yes.
So who's responsible?
Well, from what I could see, it will be the person where the human in the loop failed.
Okay.
So even if you have, for example, we take imaging. You have how is artificial intelligence benefited? It didn't eliminate the radiologist, but what we see from what I can understand now, that with artificial intelligence, the diagnosis that they could be doing, they would probably do 20 or 30 times more cases than what they conventionally do, because the artificial intelligence sifts them out and then brings up. So they ultimately have to look and fire and confirm although the diagnosis is given, the AI does not take the responsibility. It gives you that the radiologist has got to reconfirm, look at it, and then sign it off. It doesn't automatically give a AI generated answer to the patient.
Okay, so next I would.
So always, I think for all of you watching this podcast that Dr. Rajiv is with, to remember, when artificial intelligence, we always must have the human in the loop, and that is a component that will take into account many of these issues that are coming.
So the next issue is also very talked about, at the same time very sensitive, and where the public by large has also been involved in the debate. Who decides when life ends? Like if you take the example of the Terry Schiavo case, if I'm pronouncing it correctly. So she was a young woman in the States who remained in a persistent vegetative state for 15 years. Now the husband wanted to withdraw life support, saying this was her wish. Whereas the parents opposed it, believing she might recover. They were hopeful. The courts, as we all know, politicians, doctors, media, all became involved. The feeding tubes were eventually removed after prolonged legal battles. Now, first question is, sir, is withdrawing life support letting someone die or causing death?
Again, it all depends also on what was the advance directives given. There must be advance directives as to what they.
What is advance directive, sir?
Advance directive is where the patient makes a living will as to the care. You give a thing that if I do this, this is what I want. I do not want to be resuscitated. I do not want to be on,
So are people doing this who are healthy, or somebody who is forcing, they may be in a situation like this? Is this happening?
I think this is now being in the West. Certainly, it is a requirement. Most people in the well state make these advanced directives.
Okay.
So when they are done, and they then make this, and they also have someone who will be the guardian who can take over. You nominate your guardian who can take, and you give your directives. So someone will, and the medical, the legal, the hospital, and so forth have to officially. It's called the living will.
Okay, suppose there is no living will, because majority of the people won't be having.
Yeah.
Then, like in this case, who should be deciding the end of life? Is it the spouse, the parent, or the court?
No.
I'm not talking about the legal aspect. Ethically, what do you feel?
Well, again, this is a complex area in the sense. There's an ethical point and there's a legal point. They both go together. As you know, the legal part will trump the ethical requirement. Now, the issue here is who makes this decision. Now, I'll give you another situation that I have faced myself. You have someone who's in a end stage here, vegetative state, and it costs money. But in a country where you have universal health, it costs the taxpayer, and the taxpayer there is an agreement that you have to be looked after. So this is that conundrum we face. But in another case, I've had to face where some patients, some family members want the life support to be turned off. Why? Because there are two aspects to it. One, they don't want this loss of dignity, loss of all this for their family member. On another side, you have another family member who says they want it on. They believe there may be some chance of recovery.
Yeah.
So you've got these two. And of course, in countries like India, I've seen where they don't want expenses because the balance left over should be shared. So you have conflict between even two family members on what they seem to make. So in Australia, I do not know exactly what you do here. What we would do there is to apply to the guardianship board.
Okay. There's a guardianship board.
You have got a guardianship board and you've got an administration board. Administration looks after the money and so on. So the guardianship board, immediately the social worker will put an application. You go to the guardianship board, will listen to both. They can either appoint one of those family members to be a guardian.
Okay.
If they both are having difficulty, the guardianship board becomes the guardian.
Okay.
And they become the legal status to give a decision on what has to be done. So, in other words, you are talking about similarly, I think in India it will be the court.
Yeah.
In that type of situation, the court takes becomes the one who makes the decision to end the life.
Thank you for your input, sir. These were some really some situations, some aspects which our students wanted to know directly from a luminary like you.
Just to add to what you were just bringing in, there's another area that we need to bring in here, because I was just thinking about just recently. In India, you have the whole area. This comes under end of life.
Yeah.
And so there is the euthanasia. So this will be considered on why if you're stopping life support, it's a passive euthanasia.
True.
As opposed to you actually. So I understand that in India, you do not have, at this moment, euthanasia is only through a court.
Yes, legally. Yes.
Legally only through a court. Yeah. But in a country like Australia, where we've got what is called euthanasia laws, which is called assisted dying. So again, these things have to be taken. And I understand in India, the court makes even if it's a family, you apply to the court takes the decision to stop the life support, which is a passive euthanasia. But I think these are very complex, emotionally charged. Even within the family, the emotions, there are several other factors that one must be taken into account.